My colleague Elaine Reyes spoke to Xi Chen from the Yale School of Public Health. She asked him about the importance of this drug.
This is very important because compared to the previous version of anti-malarial drugs, the new drug is more effective and taking a lower dose to be effective. So that means the patients can take less dose, but achieving a higher efficiency. But this is very important because we know that adherence to doctors' prescriptions can be very important. If they need to take more dose, it's hard to adhere to that. Even if that happens in developing countries, we say that a higher cost of medical cost and the lower efficiency was part of the issue as a result of the lower adherence to treatment. So the new drug essentially proves that quite a lot.
And why is malaria still such a problematic issue in parts of Africa?
Yeah, this is a great, important question, and not only malaria, but other kinds of communicable disease. So African countries still lack of basic medications and also the infrastructure and the capacities for treating and preventing those communicable disease.
According to this report in Lancet, they say malaria can be eradicated by the year 2050 with better funding and better innovation. How realistic is that goal?
Yeah, I think this is a very realistic goal, especially when major powers, major countries in the world are going into this campaign. For example, in China, in recent years, China launched a national plan to eradicate malaria by 2020, so at a nationwide. So China's lesson and what's China learn from this campaign will greatly benefit African countries, as we all know that China has been more and more engaged in health aid to African countries. And definitely there was also many more programs from Western countries like France, like United States and other countries. Well, if they join force, they will achieve a great objective.
And Professor, it's not just malaria, but we know for decades China has donated medical equipment and other medicines to help improve local health care across Africa. Tell us more about China's medical diplomacy and other ways that it has showcased its philanthropy across Africa, excuse me.
Yes, even in the 1963, when China was very much underdeveloped, just after the Great Chinese Famine, China sent the first team of medical workers, barefoot doctors to African countries and sent the emergent medications. But China, since then, China has been fast developing, and with more and more resources being available, China is ready to help Africa in promoting health. So China has shifting its goal of just sending barefoot doctors and medications to capacity building and infrastructure building. So, for example, they are building hospitals and link the hospital with healthcare centers in the African continent. China has a continental view of Africa and trying to find the best location for the primary care facilities and link that with the hospital system in order to make sure the safety and the quality of the treatment and the prevention can be achieved. And China also now training those doctors and training the medical staff members, both in African countries, and bring them to China to have the better treatment.